There are various factors that determine the final outcome of a hair transplant procedure. Out of them, I would say most important is being the technique. How the grafts have been extracted and how the grafts have been placed and how the graft been handled during this procedure determine the final outcome of your result. Grafts are very delicate structure and most crucial part of a graft is the root. So if during the procedures grafts have been handled in a very gentle way and grafts have been placed into their natural environment after getting extracted from the donor area, then it ensures 100% graft survival. If grafts are allowed to place outside your body for a longer period of time, they are subjected to desiccation, dehydration, and also there is a possibility of decreased graft survival. So simultaneous graft placement after extraction from the natural environment is known as the real-time placement or real-time FUE technique. This is the technique that we use in all our patients for the hair transplant procedure. This topic is all about our technique of real-time FUE and how it is different from conventional FUE technique. If you see the whole process of a hair transplantation, it includes 4 essential steps. The first is the anesthesia technique, where we give a ring block in this area so that the whole area become numb. Second step is the slit making, where we prepare holes for graft placement, and that time only we decide the density, we decide the angle, and we decide the direction of the graft to be placed. Advantage of making slit before is that it gives an idea about the number of grafts that we need to extract. And second thing is, as we are preparing slit before and placing the graft into the pre-made slits become a passive process and there is no chance of alteration in the direction or alteration in the angle. Then third step is the graft extraction, and then final is the graft placement. In conventional FUE technique, what is being done? First grafts are extracted, then slits are prepared, then displaced using either forceps or a implanter. So in real-time FUE, difference over conventional FUE is that after the anesthesia and slit making is over, then this third and fourth step is performed simultaneously. That means once the designing or the pre-made slits have been made, then what we do, we extract the grafts and put it into the pre-made sites using a implanter. So first patient lie down on your left side, grafts are extracted from this area. When being extracted from this area, this is being simultaneously placed without keeping them outside. Similarly, at the end of the procedures, when we have completed extraction from this area, around 50% grafts have been placed into the pre-made sites. Then patient is lie down on the stomach position and grafts are extracted from the back and then simultaneously placed over this area. And finally, when the grafts have been extracted from this area, it is placed over this area. At end of the procedures, we take very fine hairs from the lower part of the donor area and we cut it to true singles using magnification. We put true single hairs over the hairline zone and also temple area. So this is the basic difference of real-time FUE over conventional FUE, where grafts have been placed simultaneously without keeping them outside, which ensures least body out of time of the graft, and also as grafts are getting back to their original environment without being kept outside, so there is least or minimum risk of any infection or any graft dying, leading to 100% graft survival. Other modification that we use for this technique is the use of implanter. Most important part of a graft is the root, so which controls the growth of a hair. So if a graft has been damaged, that leads to decreased viability, decreased survival, and so final density what we have expected of a procedure. In this implanter, what we do, graft are placed very superficially from the upper part and loaded into the implanter, and then this loaded implanter and pushed into the pre-made slits and graft are placed gently. Throughout the procedure, we ensure minimum or no root touch technique that leads to 100% graft survival. Other advantage of using implanter is that it ensures angle, it ensures direction, which is very crucial for the hairline and temple points. As you are using implanter, there is no chance of popping or no chance of grafts coming out, so that we can give very high density even if you are using very thick grafts, which is sometimes difficult to place thick grafts using small holes in a forceps method. But in implanter, there is no such resistance, as because we are pushing the graft into the pre-made site using implanter, the process becomes passive process. And other advantage of this real-time FUE technique is that as the process of extraction and implantation is being performed simultaneously, so everything is done under supervision of doctor. When a doctor is doing the graft extraction, simultaneously grafts are being placed in front of him only. So whole the process is completely controlled and completely supervised by the doctor. Modification of these techniques like simultaneous graft placement and using of implanter ensures 100% graft survival, and also it possible to get a very natural looking high density results.